Basically, we want to put out the best physical therapists that we can possibly put out.
Beautiful. Yay!
They graduate with a Doctor of Physical Therapy, which is a far cry from when it started back in 1931, and they earned a certificate. But during that time, it has constantly recognized that we needed more and more education in order to be able to integrate all the information of healthcare and be able to figure out, deduce what the problem is and how they can make a person with movement disabilities get better. And so that's our primary goal, is to put out the best physical therapists. In the summers following their first and their second year, they do a clinical rotation full-time in which they are going out into hospitals, into rehab centers, into outpatient clinics, skilled nursing facilities, school systems. And basically, under the supervision of a physical therapist, they practice what they've learned. And then in that final 3 8-week clinical rotations in their final year, that's when they are basically working as a physical therapist, still under supervision, but being much more independent.
The interdisciplinary approach is really important, especially for physical therapy. So in different physical therapy settings, we'll work with occupational therapists, respiratory therapists, doctors, either surgeons, primary care. There's lots of team interaction, and really the patient benefits most having all those different approaches come together. So in school, we start our program with occupational therapy. We go through anatomy together, and then we do have some labs with occupational therapy. There are some lectures, other allied health lectures that came in, clinical lab science and pharmacy, and they're teaching from a pharmacy perspective, but they're trying to say, why should this matter to physical therapists, and how can we use that to our advantage, just having that knowledge and better our patient care, really.
I'm proudest of our graduates, of our alumni, because they are out there, they're doing the daily work, and when the clinicians talk, when the patients talk, they're always lauding the abilities of our students to get out there, our alumni, to get out there and actually make them better, make them able to get up and walk again.